And how are you this evening?
I am doing great. Are you in upstate New York or in Texas?
I am in upstate New York.
Okay.
Whitney and I met at a conference, so that was kind of how we developed our relationship and started working on the MOOC together.
All righty. I lost seeing you, and you probably don't see me, do you?
I don't know. You know, I turned my video off.
Okay. All right. No problem. I'm good.
Okay. So my first question is just, did you enroll in the human MOOC more than one time?
No, I just took it once.
Okay. And prior to enrolling in the human MOOC, did you participate in other MOOCs?
Yes. I do 3 or 4 a year just to keep up to date on lots of different topics.
Okay. Can you tell me a little bit about some of the other topics you've taken?
Sure. I have taken one on patient outcomes that was sponsored by Ohio State University. I have taken one on Alfred Hitchcock, 50 years of his work. I'm currently in one right now with the London South Bank University on understanding mental health. And I've taken several others. I think it's been about 4 years since I first started doing that. So I took one on global nutrition, which was really great.
So you've taken a wide range of topics.
Yes, I am a lifelong learner, not just as a nurse, but just in general. I'm very curious, and with the Canvas MOOC, they actually offer quite a wide variety. So I do some related to healthcare, medicine, but then also do some others. I took one also this year on ocean literacy, which was very interesting.
That does sound interesting.
Mm-hmm.
What was your specific motivation for taking the human MOOC?
Well, I actually took it because of my collaboration with Kathleen Sisman and Jean Watson. I obtained my master's in 2015, and my capstone project was on mindfulness. And so I had the pleasure of working directly with Jean and Kathy as I was developing my project. And in my collaboration with Kathy, she told me about the upcoming course. And not only did I take it, but I recommended it to some other people. And I think I had 2 other colleagues take it. One that wasn't a nurse, but works in a healthcare arena.
Okay, that's great. And when you started the course, did you anticipate, completing the whole course?
Yes. When I was a little girl, I was a Bluebirds, and one of our mottos is to always finish what you begin. And I've never missed that.
Awesome. So you've completed all the MOOCs you've taken?
I have probably, I'd say about 14 altogether that I've taken.
Oh, that's great.
Mm-hmm. And I've taken some also at the college where I teach. They have programs as well regarding the canvas.net is what we use where I work.
Okay. And did you earn any of the badges in the course?
Every course I've taken, I've earned them all. Any course that I signed up for, I usually dropped within the first week, but any course I started and continued with, I always earned the badges, the certificate.
Okay. And maybe it's what you said previously, but was there something different that motivates you to earn the badges, or?
Well, being a nurse, I obviously keep up with education, and I like having other sources than just pure nursing. I've been a member of the American Association of Critical Care Nursing since 1984, and I still do CE programs, and I do the webcast that AACN has.
Mm-hmm.
I also, for a couple years, had a membership to the New England Journal of Medicine, and so I did the CME programs in that. So I'm a professor, and I teach mental health and med-surg oncology. And then I also have a consulting business. So I like to keep up with healthcare, but different aspects of it. So from physician perspective, nursing perspective, business perspective, innovation, different things. So I'm always really in some kind of a class. I'm always reading different books. I'm right now reading a lot about ketotic diet and how that's improving outcomes for patients with cancer. So I'm a curious person by nature.
And is there something specific about the idea of earning a badge? So, for example, like if there wasn't a badge, was the idea of getting the badge motivating to you, or was it just
No,
add-on? Okay.
no, that'd be like aiming to get a Hello Kitty purse or something. It's nice just to kind of with the Canvas program, the MOOC, you get a PDF transcript, so it keeps tabs of your courses. I also do webcasts through an organization called GLG. It's a consulting company that I work for, and I've taken a lot of very unusual webinars there, from the extra virgin olive oil production to drone technology to the challenges with cannabis, medical cannabis. So I just kind of keep track of the different education I have. And if I see I have a gap in, some area, then I seek out to learn that.
Okay. And when you reflect on your learning in the course, are there one or two key takeaways from the course that you can share with me?
Well, one of the ones, it was very beautifully done, was perfect timing. I felt so fortunate to have it, just basically finishing up my master's in May, and then the course started in June. So it was very nice to kind of have things presented that I had just researched and, learned from Dr. Watson and Dr. Sitzman. But I loved the discussion boards. I always love discussion boards because I learned so much from the other students. And I also love the Mandela aspect. I'm kind of a left and right brain, and I love all that creative aspect. And I loved it so much when I'm teaching mental health. The nursing students will say, oh, I'm going to teach like breathing relaxation. I'm going to teach imagery. They always kind of stick to the same type of things. And I'm like, what about doing yoga? Or what about doing a mindfulness exercise? Or what about, coloring project? And so the last couple of quarters, the students have done a coloring with the mandala, and the results are just mind-blowing. So I use a lot of what I learned in the MOOC course when I'm teaching students. So I'm utilizing it. So it's stuck with me.
That's awesome.
Mm-hmm.
Were you familiar with the community of inquiry model prior to taking the course?
I actually don't recall, was learning so much in school. I think I actually learned it in my master's program first.
Okay. And how did your experience in the human MOOC enhance you may not be able to answer this, but how did your experience in the human MOOC enhance your understanding of the community of inquiry framework?
Well, I don't know if I can honestly say that it made any great difference. If you could, just to make sure, because that's a term I'm not, using every day, could you tell me exactly what that's defined of, to make sure that I'm thinking the same thing you're asking me?
Sure. So each week in the course centered around a different aspect of the community of inquiry framework. So one was social presence.
Mm-hmm.
That would be like, say, student to student, student to, teacher interaction. One is cognitive presence, and one is teaching presence.
Mm-hmm. Yes, so I did also learn that in my master's program that I was in from 2013 to 2015. So from what I recall, and I apologize, it was over 2 years ago, but I just thought that I've taken, like I said, other courses, and they weren't as highly organized, and they didn't build on the knowledge and critical thinking on the topic as well as that class did.
Okay.
So I would say two of the very best courses I ever took on the Canvas program was the one we're discussing, and then the Alfred Hitchcock one, because I like the variety, not just direct information to read, but the interaction with the discussion boards and things. So I would say that the framework worked very nicely for the topic.
Oh, that's great. Thank you. Was there
Mm-hmm.
something, was there one, specific experience that you would want to share that really stuck out for you in the course, or, really helped you deepen your understanding of something?
Well, in addition to reading the comments from the other attendees, I think what I also respect a lot is that not only Kathy, but the other faculties, the other teachers actually were active in their comments back to people on the discussion board. So it wasn't just this blind, you make a comment and it goes into Never Never Land and nobody else responds. I thought that it was a pretty amazing, I don't know how things were divided up, but there was a lot of back and forth interaction. And I thought that was great, because sometimes I think that with online classes, you think you organize your thoughts and you send them out to the universe, and if nobody comes back and says, oh, that's great, but actually, and so I thought the feedback was very good and targeted, and it kind of made you feel a higher connection than some classes, like the class I'm taking right now. Not saying anything, but you can tell there's a lot of material there, but I think I've seen the two instructors respond back a handful of times in the 4 weeks I've been on the class. And I think that's kind of sad a little bit.
That's great. It's great to hear that makes a difference, and really, build on the community of inquiry framework.
Yes. Mm-hmm.
So shifting a little bit to, your experience with technology, if you think back to when you first started the course, can you tell me how you felt about using technology in your teaching?
Well, I started the course actually very gifted, because my master's program was 100% online.
Okay.
And so any trepidation or anxiety were kind of over because we had to do various things. I had to audio record myself on a PowerPoint and upload it to share with the instructor and my other colleagues in classes, and then with developing a poster for my capstone. So I had a lot of I'll call it advanced work. I had to understand and work with IT. And so with the MOOC class, and the reason I continue on is it's just fairly intuitive. And I really have never had any problems. And the college I teach for, we use the same LMS system. And so I feel very comfortable with it.
Now, outside of the class, were you also using some of that technology in your teaching, or was it mostly in as part of the projects in your classes?
Well, I use the technology in my master's program. I use the technology in the course that we're discussing. And then I currently still use the technology not only for the classes I take on the canvas.net, but also in my teaching. I have clinical time, obviously, with the students, but the rest of the time, everything's online. So their assignments, their clinical reflections, their papers, all those type of things. So I'm comfortable in reading and commenting and uploading grades, etc.
Okay. And do you use video in your online courses?
I do not.
Okay. Could you tell me a little bit about, your reasons for not using it?
Well, I don't have jurisdiction over developing the courses. The way that the college is set up, it's different ways. We do use videos that have educational material in them. But as far as a student needing to talk to me and us you know, me creating a video or something. It's just not something that's set up at the college. I do kind of a midterm evaluation.
Mhm.
And if I don't have the opportunity to have a one-on-one session with the student, we utilize Skype and, you know, use the video component for that. But as far as me like making a video on heart sounds, for example, the college uses a lot of purchased materials for various learning topics.
Okay. And prior to enrolling in the Human MOOC, did you, you know, outside of video, had you had experience using tools like VoiceThread or Flipgrid?
The first one, yes. I actually was based in Europe in 2004 to 2011, and I led a clinical and marketing team, and we did webinars for people throughout the world outside the United States. And so I learned that technology very quickly because we had people from all over the world, you know, that were coming in, and you could actually see the attendance, you could take comments, and then when I moved back to the United States, we still kept on with that. Both of the second one that you mentioned, I'm not familiar with at all, but I've used WebEx and some of the various things in business to do educational programs in a couple of my jobs.
Okay. So Flipgrid must not have been used in the iteration of the course when you took Human MOOC.
No, I'm not familiar with that term.
So thinking about a tool like VoiceThread, you know, you mentioned how much the discussions enhanced what you got out of the course. Do you feel like tools like VoiceThread enhance it even further than, say, just, you know, an asynchronous discussion where you're typing back and forth?
Yes, absolutely. And even in my master's program, some of the courses just didn't fully work, like ethics, medical ethics. So many times there was a discussion going on about a sensitive topic, and the asynchronous typing, it just would have been better to have the ability to kind of interact a little bit more. I think it would have been more powerful for not only myself, but the other students. Because there's a lag, right? If you're having a good discussion and everybody's being respectful of each other, it just you kind of lose a little bit of the momentum. So to utilize a voice activated communication tool would be fantastic.
Okay. Can you tell me a little bit more, you know, if you think about a tool like, so Flipgrid is similar to VoiceThread in that instead of typing in, you know, my response to a discussion, I might make a short video. And then when you watch my video, instead of typing in a response, you might, you know, do a video response.
Correct. No, it would be fantastic to have that. I think the more communication is enhanced, you know, and to be real, the better communication is transferred from one being to the other. So I think that would be fantastic to be able to use that with the Flipgrid or any other modalities that are created.
And thinking about from the standpoint of, you know, one of the things that we discuss in the course is that tools like that help to humanize the course and build greater community. Do you feel that, you know, using tools like that enhances courses in that way?
Oh, absolutely. I think the more, using the term you just said, that the more humanizing ability that a course has, the better that people will learn, because we know that people learn different ways, right? Some are good book learners, others actually need to see and things like that. And people that maybe are more tactile learners or whatever, I think it just enhances for the different types of learners that we have on the courses. So any way to kind of bring the classroom even further into the student's home is the better. So we know that there's, you know, tone can tell you if someone's upset, anxious, you know, scared, whatever. And I think that would enhance the course a lot.
Okay, great. And thinking back to, I know you mentioned that you were in the master's program and, you did apply some of these things in that program. Can you tell me a little bit about how confident you were in your ability to implement something new that you learned in the course?
Well, I would say my confidence level was pretty good. I think I'm a little older than you from the quick view I saw of you, but I think that a lot of challenges that some older people have, like with implementing EMR, I've read studies about some nurses that have, left their practice, et cetera, just because of the stress and anxiety with technology. I think I was fortunate. I left the hospital where I had a fair amount of IT experience, but mainly just emails and communication, and went to work in industry where I very quickly had to be communicating with other colleagues, developing CE programs, interacting with, doctors, nurses, biochemists, et cetera, and then helping out with symposiums, doing PowerPoint. I just continued to always be learning and enhancing my skills.
Okay.
And I think that I've just always been fortunate to continue to grow in that arena. I mean, I've helped physicians do PowerPoints for, the European Society of Cardiology, and done all of those different things. And so I just am always curious about it. And it goes back really to my first days in intensive care, where you're overwhelmed by an arterial line and something happens to it, and you just have to go back, kind of do check A to Z to see what's wrong. I always tell myself that I'm smarter than the technology, and so I have to figure it out. So I would say, because of my varied background as a nurse, it really greatly enhanced my IT ability, and I've had some really wonderful people along the way that have helped to teach me and help me to understand.
Okay. And that leads into my next question. Can you tell me a little bit about any support system you have where, if you're implementing something new, you might, go to for help?
Well, when I was in my master's program, I would communicate with the IT people at the university where I teach. It's the same thing. If I need help, I have a very dear friend who's kind of an Apple expert if it's something specific to my MacBook.
Mm-hmm.
And I go on and kind of look myself. I was the reason I had to change our time last week. My mother had to have emergency surgery, and I wound up having to change her computer ink. Well, it was a printer that I was not familiar with, so I just went on WikiHow and saw the video how to do it, and I changed her computer ink. So I'll do the WikiHow or YouTube, and go on and learn things. And then I also like to try to help others, because people get kind of fearful that they can't do certain things. My mother's 80, and she texts and she takes pictures and sends them, and I just think that's so cool. So I think the more that we are open to learning new things, whether it's IT, technology, or new things that enhance communication, enhance the ability for us to educate, it keeps dementia away from us a little longer, and keeps us young.
Yes, I think you're right.
Yeah.
Going back to the course itself, was there any type of major transformation in your thinking about technology in your teaching that you could tell me about?
I don't think specifically from the course. I had my epiphany already with my master's, because I had doubts that I could succeed with all of the papers and the Turnitin and all the different technologies I had to utilize, even doing research, at a virtual library. And so I really had accomplished a lot before I took the class. So I didn't feel any anxiety or stress with the way the class was set up, or have any any problems with it. And so I think I was pretty well trained in advance of the class, if that makes sense.
Yeah. Yep. Yeah.
Can I, I'm sorry, can I just put you on hold for 1 minute to go get my 3-year-old? She's calling me. Hold on 1 sec.
Can you take the tops off the peppers? Salad.
Mm.
I'm just talking to a lady right here. Do you want to listen? Yeah, I have a friend and we're just talking for a minute. And then we'll have a little tea party, okay?
I only have one other question.
Okay.
And my last question is just, are there any similarities or differences you can tell me about between how you experienced something in the human MOOC and in your own practices?
I just think that the human MOOC was kind of a validation for me
Okay.
because I had worked so closely with Jean and Kathy and did so much research and interviewed some college administrators, and I just think it was kind of good to kind of see everything, and I just think it enhanced it to a deeper level.
Okay, great. Is there anything else you want to share?
Well, I just thought the class was amazing, and Jean Watson's been my hero since I first was a nurse, and I just couldn't believe how approachable she was, and Kathy as well.
Okay, great. All right, well, thank you so much for your time.
Thank you. Thank you very much. All righty. Take care, Patrice. Happy holidays.
All right, you too. Bye.
Bye. Oh, my goodness.